This is Hattie. She's just over 2 years old, and this is Rupert, her son. He was the third born. She was expecting 2 from what we knew on the ultrasound, and they'd both been born. They were a few hours old, and we decided to bring them along with their mum because the little girl wasn't latching on well. Turned out she was fine. But coming round the roundabout on the way into the practice, out popped a third pup, and nobody was expecting him, and he's a bit of a one-off because they don't usually have these markings. We weren't quite sure what to expect, but here he is 8.5 months later, and he's full of vim and vitality, and they're doing fine. I think Triovet is different from the majority of practices now because it's one of the relatively few independent ones. They're getting less and less all the time. The chains are taking over. And for me, that's not a great thing. They control prices, they control the kind of drugs they use, and it's to the detriment of the independents, who I think give a more personalised experience and, well, as far as Triovet's concerned, certainly better care. It's pretty easy to get an appointment. Usually it might be a day or 2 if it's something routine, but when we've had emergencies, we've always been able to bring them in with no delay, and they get seen promptly. We've used the out-of-hours service, a number of times actually. We have 11 dogs in total, so you can imagine things crop up, and we've had some oldies who we've had to say goodbye to, and sometimes that's quite sudden. But it's always been dealt with promptly, efficiently and kindly. I think the support's particularly important when you're losing a pet. It's always horrible, it never gets any easier. I've had 30 dogs in total, and I certainly never get used to it, but it makes all the difference in the world to have personalised service from people you know and who know how you feel about your pets. While we've been with the practice, we've had some quite worrying episodes. We had 2 dogs related who both had ruptured gallbladders, and that's a horrendous problem. They had to be referred, but although it's an independent practice, they get referred to the same secondary care that all of the chains use, and that was handled really efficiently. We were moved forward onto the secondary care without any delay, and then back to the practice for aftercare after 2 really horrendous operations where there was a possibility they'd either die during surgery or within 2 weeks afterwards, about 40% chance. So they both came through fine, and they're both happy at home.